Thank you so much, everybody, for attending the Knowledge Gap Medical Student Perspectives on Gender Health Inequity today. We have a fantastic lineup, so we're going to get started. First off, we're going to have Daria actually do a quick land acknowledgement, which is how we like to start our events. So we'll just go to the next slide for that.
Hi, everyone. I'm Daria. I'm going to be one of your hosts for today, so I'm really excited for the panel and to speak with all of you and also our amazing speakers. So before we begin, a quick land acknowledgement. So although we're located all around the world, I'd like to start off today by acknowledging the land on which myself and the university at which Medical Herstory is founded at is residing on. So Medical Herstory acknowledges that our events and spaces for discussion take place on the traditional territory of the Indigenous peoples, such as the Kanien'kehá:ka, on the island known as Montreal or Tiohtià:ke in the language of the Kanien'kehá:ka. The Kanien'kehá:ka are the keepers of the eastern door of the Haudenosaunee Confederacy. This island has also historically served as a meeting place for other Indigenous nations. We encourage you all to take time to learn about the land on which you reside. It is not enough to just acknowledge the keepers of this land. Silence and inaction will only contribute to erasing the history, the culture, and the realities of Indigenous people. As such, it is important that individuals educate themselves on Indigenous matters and that they apply that knowledge to support Indigenous communities. We should all actively resist neocolonialism in the many forms it takes and the diversity of forms that resistance can take. And also, we cannot begin to discuss patient advocacy, barriers to accessing care, or internalized stigma without recognizing the role that colonialization, white supremacy, and medical racism play in the social structures which healthcare as an institution is situated in.
Thanks so much, Daria. We'll now do a quick introduction to Medical Herstory. I know some of you are at many of our events and have heard this many times, but for those of you who are new, I'm Tori. I'm the founder and executive director at Medical Herstory. And what we are essentially is an international not-for-profit working to eliminate sexism, shame, and stigma from health experiences. And we advance gender health equity through many different ways, but mainly through medical education, patient advocacy, and undoing stigma. We hold events, workshops, we publish stories, and run social media in order to raise awareness on these really important issues and create community around them. So we hope that you enjoy today's event and definitely follow us on social media at Medical Herstory to learn more about what we do.
Andre, can you go to the next slide, please? Thank you so much. So a little overview of today's event. So actually, this event is one of the first installments of our storytelling series, which is going to be happening over the next couple of months. So definitely go check out those series as well when we start. We're still kind of in the process of establishing exactly what we're going to be focusing on, but there's going to be some very interesting topics coming out soon. So each session focuses on a specific health experience relating to protecting bodily autonomy, addressing medical harm, improving medical education, and developing self-advocacy skills. So today, we bring together medical students to share their experiences with the shortcomings of medical education on gender and health. And through this, we kind of hope to highlight the ways in which future physicians can contribute to improving patient-centered care. Next slide.
Awesome. And then with that said, Salma, who is on our events team but isn't here today, has been chosen for one of the Oxfam grants working to advance gender health equity and raise awareness around sexual and reproductive health and rights. So we want to give a shout out to Oxfam for sponsoring today's event.
Perfect. Thank you. So just some quick Zoom rules before we actually get into the panel itself. Please remain muted if you're not speaking. And if comfortable, please do keep your cameras on. It's always lovely to see everyone's faces and kind of have that one-on-one interaction, even though we're online. And also, please do feel free to use the chat. So ask questions or maybe raise any comments or just interact the chat. We have people who are going to be interacting with the chat as well. And maybe we can also use some of those questions for our Q&A later on. And also, we always have active listeners present. So today, our active listener is Sarah. Sarah will be available in the chat if you want to message her directly and just basically ask any questions. If you are ever feeling uncomfortable, you want to take a break or discuss something, please feel free to message Sarah or also take some time off of the Zoom and come rejoin us later on. And also, please be respectful to everyone. This is a very open discussion. And we're going to be talking about a lot of different topics. So definitely kind of come to this session with open ears and ready to talk and discuss anything. And note also closed captions are enabled, so you can activate them at any time during the event if you would like to do so. And then next slide. Thank you. So a quick content warning. So topics of discussion today may include sexism, racism, ableism, medical trauma, mental health, and other sensitive subjects. Medical Herstory does recognize the challenges of today's discussion, and we are extremely grateful for our speakers in sharing their knowledge and experiences. Please practice self-care and take breaks if you need. Next slide. Amazing. So let's get right into the panel. So we're going to start with a quick introduction of our speakers, which are these three lovely people who we have with us today. As part of, usually we do a little bit of a bio and I introduce the speakers, but we decided that today we really want the speakers to introduce themselves as kind of the first part of the panel question. So I'm just going to ask each speaker to introduce themselves and also kind of start by answering, why did you decide to start sharing your medical school journey online? And how has this changed the way that you approach medical school? So if Sabina, would you like to go first?
Yeah, sure. I can go first. Hi, everyone. I'm Sabina. I use she, her pronouns. I am a fourth-year medical student at the University of Pittsburgh right now. I'm currently applying into OB-GYN, so I'm just waiting for the match in March. I decided to start sharing my journey online in 2018 as I was gearing up to apply to med school because I had a non-traditional path to med school and that I had a lower GPA in undergrad. And at the time I was looking for representation and anybody's stories online of success going from the GPA that I had to medical school and then on to becoming a doctor successfully. And there just wasn't really that much representation online yet. People were still kind of hiding, or not hiding, but it was kind of like a taboo topic to be so open about not being the best test taker. So I was like, let me just document my journey from start to finish. And so in 2018, I started the account right before I submitted my med school applications, not knowing how it would turn out. Got into med school and I have been documenting the journey ever since. And I think for me, how it has helped me through med school is, for one, I'm just like way more transparent and open, both online and also just personally, like on rotations and such. I don't really hold back in terms of needing to make people know that like I'm tired or just prioritizing mental health and all of that. But also I just have such a great community through my friends online who I've met, as well as those who I've had the chance to meet in person. And so I think my community of queer representation especially has expanded because I have access to such a lovely community online. And I'm really thankful to be able to share my journey with everyone.
Awesome. Thank you so much for sharing. And we are so excited to have you at our event today. Next, Rainey, would you like to introduce yourself?
Yes, absolutely. Hi, everyone. I'm Rainey Horowitz. I was born and raised in St. Louis, Missouri, and that's where I'm currently a fourth-year medical student as well at St. Louis University. And I created an Instagram account in 2020 in the heat of the pandemic as kind of a passion project to try to distract myself from everything that was going on in the world, but also as a product of kind of using some of the different skills that I had from the education I had before medical school. So for example, I went to a huge state school, which there was not a very large undergrad, or in the undergrad population, not a ton of pre-med representation. There wasn't even a pre-med like guidance program. And so I truly had just like my friends from other schools giving me resources and telling me when I should apply and things like that. So I was very lucky in that I ended up getting accepted into medical school, and really at the beginning was jarred with how much I felt like I was not like the people in my class, and it was hard transitioning back home, and I really just felt like I didn't see other people who looked like me and thought about health in ways that I did, and specifically in around the ways of sex and sexuality and why it should be important in healthcare. Well, and that was a huge part of my research during my undergrad and my master's, was in history and philosophy of science, of basically the medical misconceptions and gendered expectations and moral traditions that affected especially the femme type identifying people throughout, well, I can more say the last 200 years, but it's an ongoing problem and history has continued to repeat itself. And so I really wanted to make my page to be kind of a place that people could have medically digestible and accessible information that was evidence-based about sexual medicine content that was for providers and for patients. So using language that you didn't have to have a medical degree to understand. While sometimes I do use some complex language, I try really hard to break it down into words that are a little bit more digestible. But my current research interests are in things that are a little wacky. I am doing a lot of research in things like medical uses for vibrators and how we've been so sensitive to the word vagina, especially in form of censorship, and just really trying to increase sexual health literacy and take stigma and shame away from physician spaces, specifically in urology, because I'm a fourth-year medical student waiting like less than 2 weeks until match day. So that's where I'm at. So happy to be here, and thank you so much for having me.
Oh, thank you. Thank you so much for sharing. It sounds like some pretty amazing work. I'm excited to hear more about that later on. Amazing. Thank you. And I guess our last, but definitely not least, speaker, Nava, would you like to introduce yourself?
Yeah, so hi everyone. I'm very excited to be here. Tough to follow after that one, but I was born and raised in Barrie, Ontario, so I'm from Canada, and I did my undergrad at Western in a Bachelor of Medical Science degree, and nobody else in my family is in medicine or anything like that. So during COVID, I felt very, lost and confused with the whole application process to medical schools. I had a few friends, but it's just kind of notoriously known that it's impossible to get in and it's just very daunting. So I wish I had started documenting my first application cycle because I was rejected from everywhere. And I just feel like there's a big stigma around, or even on the forums that I was on, just like everybody that's top tier, highest GPA, highest MCAT would be sharing their stats and they all got in, but it's like there really wasn't representation of the people that weren't getting in, that were also, highly trained, had great marks, had a great life experience. So I wanted to really just showcase that you're not alone, because I know that I had felt alone, and there was a select few people I'd see on TikTok that really inspired me, female physicians and some other medical students that kind of gave me that push to keep trying and keep sharing that experience and let people know that, it's not uncommon to be failing and to take a few times to get in. So I shared my second application cycle, and it was just nice. There's a really good community online of people connecting and, sharing their stories. And you do realize that you're not alone. You're not alone if you're failing. I wrote the MCAT 3 times. So a lot of people, connected with me on that level of, it's not you, it's the test type of deal. It has like no gauge on how smart you are or anything like that. So I just wanted to be very transparent to other people who are trying to go through this process, to let them know that you're not alone. And, to be a female in medicine, because a lot of the time it's a male dominated field historically. So just again, to see some more people showing that if you're a woman trying to get into medicine, a woman in STEM and all of that, like, it's just nice to build up that community.
Amazing. Thank you so much. I'm also from Ontario. So I live actually really close to Barrie. So nice to know you're from there. But thank you so much for sharing. Very excited to have you be our speaker as well today. So now we're kind of going to go into the actual panel itself. And the way this is going to work is that I'll ask a question and then I'll open up the floor for the speakers, or maybe ask more directed towards a specific speaker and then go from there. And then Ellen will be very kindly also posting the questions in the chat. So if you want to refer back to the question, I'll be in the chat. Or also if you just want to read that instead of hearing me speak, that is also an option there. And then I'm just going to make sure that we're just going to pin all the speakers here. I'm just going to quickly do that. But yeah, so, and then after that, we'll have some time for a Q&A, but also definitely feel free that if at any moment you feel like you would like to ask a question in the chat, do feel free to do that as well. Okay, we'll get started. The first question, I'm gonna start off by asking Anava, but also everyone can feel free to jump in after. But how have you seen health equity and gender health equity in particular incorporated into your medical school curriculum?
So I will say, it is quite lacking. I can see the efforts being made just to, especially like in our dermatology units and stuff, to show different races and like different skin conditions, and they are trying to be more inclusive. But of course, it's lacking on, I think, presentations of male versus female for specifically, I just recall like a lecture we had for myocardial infarctions or heart attacks. And I remember a student asking, she said, well, it's pretty well known that women can present differently with these signs and symptoms. Could we get a little bit more information on that? And then the professor, he said he'll give us more resources afterward, but just the fact that's not included in that curriculum when, you're going to be seeing male and female or non-binary patients, like you need to know different signs and presentations. So the curriculum is trying to evolve. I do see a genuine push towards that, and our professors are very receptive to feedback. But I think the main thing is I see the change with students. It's my classmates that are the ones pushing, asking for that change. Like I said, asking for it. Well, could we get some more information on female presentation of the symptom? And there's a lot of interest groups within our medical school for just women gender equity, just like that, and other things. So there is a push with the student momentum, but I think that's very important because we're the ones that are going to make the change. It's not necessarily the institutions, it's us asking for the institutions to make the change. So it is very heartening to see everybody advocating and asking for more diverse images and information on all the topics and giving feedback to our professors who are very receptive. It's just, you need to let them know what we want to see in order for that change to be made.
Oh, very interesting. Thank you so much for sharing. Sabina, do you feel like it's the same thing? Have you had a similar experience at University of Pittsburgh, or do you feel like it's different? Can you touch a little bit about your experience?
Yeah, I definitely think it's the same and similar. I think across the board, most med schools have a similar approach. A lot of them are rooted in a traditional, it is what it is mindset, and it definitely is a generational shift when it comes to medical education, which we're thankfully seeing now. And then I also think that our voices are being heard a lot more just because, one, we're being a lot louder about it, but then also folks are having like sort of an external social pressure as well from patients and the media and such to just do better in terms of how we're training our physicians around equity, especially when it comes to gender and like queer health and racism in medicine and all of that. So I think at Pitt, when I came in, I'm a very loud student when it comes to advocating for equitable education. And I came in like swinging about, just we need to be better about LGBTQ health education for our students. And the school was really receptive to hearing that. And then using that momentum and other students' energy, we've been able to make a lot of progress around queer health, but then also with that comes progress with gender equity, as well as with like racism in medicine equity and such. So I think specifically in Pittsburgh, there's been a larger effort around gender health equity because right when I started med school in 2019, there was the release of a Pittsburgh Gender Equity Health Report that was the accumulation of years and years of data and analysis here. And they actually saw that there was a pretty stark contrast in terms of how well, or rather how poorly Pittsburgh was doing when it came to equitable healthcare for the different genders versus other larger similar cities. So they already had a pressure from the city as a whole to do better. And then with the energy that came with my class and the ones below me, we've just been able to make a lot of progress. So there's definitely hope, which is it's been fun to like be part of that, but also, it's kind of like frustrating to think about how physicians and providers have been trained all these years and why isn't this something that has been considered before, but better late than never, I suppose.
No, thank you so much for sharing. That's very interesting, and also definitely interesting to just hear about kind of like the different pressures that are acting on this, not just the students or maybe the physicians, but also the city and things like that. It's really, really fascinating. Actually, can I ask you a quick follow-up question about that? Do you feel like you've kind of found more community in med school through these like different efforts to raise advocacy? Like, do you feel like that has really improved the relationship between the students within the medical school community as well?
Yeah, for sure. I mean, some of my closest friends are the people with whom I've been doing these advocacy efforts. And also, I'm really close with some faculty members who've been just really excellent student champions. And I think all of that has really brought us together because we have this shared energy and passion to improve medical education and the training that we're receiving, both pre-clinically and clinically. And then with the onset of social media and how big that became, how big that was, but then also how important that became during 2020 for community with COVID and the pandemic. I feel like my social network in terms of like-minded med students and people who just get like amped up about the same thing as me has expanded so much ever since I joined like med Twitter and Instagram. So I definitely think there's a lot to be gained from having shared experiences with advocacy and shared passions.
Yeah, amazing. Thank you so much. And Rainey, I guess on a very similar vein, kind of, have you seen health equity and gender health equity in particular incorporated into your medical school career, but also maybe you could touch a little bit about your previous research experience and how you've kind of seen that incorporated into that as well would be great.
Absolutely. Yeah. So I have a very kind of bizarre experience of going from one of the largest state universities to a very small Jesuit medical school that has like religious restrictions around a lot of the procedures, around the things that we are allowed to learn about. For example, we did not have a formal lecture on contraception, and we did have a formal lecture on natural family planning. So there were things like that I had to get really used to. And that was actually a big part of what galvanized my energy around making my page, was because I felt that there were so many things that were missing from the curriculum, just out of, the restrictions of the university. And as a private university, they're entitled to that. And I, chose to go to that school, and they did give me an incredible education, but there were a lot of limitations on the things that we did learn about. And, I also was in my preclinical years at a time where we're just starting to change textbooks and create more of a urgency around teaching the anatomy of the clitoris and why that's important, because some patients have pathologies of these tissues and vulvar anatomy as well. And so I think that my school, it really came from the students belonging to like the LGBTQ and, beyond, everyone who was kind of like non-conforming has really been the leaders in the kind of social justice avenues. For example, our medical students for choice group was, not recognized by the university for the majority of my medical school experience. And then with the really persistent efforts of some incredible co-collaborators, we were able to not only get recognition from the school, but be able to have events where we taught what the, dosing and, proper administration and therapeutics are for how to perform an abortion in states where it would be legal, since in Missouri, abortion is completely illegal at this time. It's really come from kind of like an underground uproar that has become so loud that the university has been willing to, be really responsive. And I'm really grateful that there have been enough people who felt that there was something to protest. And it's also been really great to collaborate with other institutions in the area who don't have as many restrictions for religious reasons. For example, in Missouri, we planned a panel for reproductive rights because that's been a really big issue, especially in Missouri with WashU for medical students and law students. And so collaborating with other schools and trying to kind of expand our network has been really great. And I really think that I'm totally echoing what Sabina was saying earlier about how patients are really holding their providers accountable now. And I think that also is really can be expanded through the medical student experience, because medical students really are a big part of the teaching that their attendings have. And as so many of you medical students know, your attending will tell you that we're lifelong learners. And so this is just, I think, a really big part of that. And patients are teaching their providers, students are teaching their providers, and it's really important to have these conversations.
That sounds like some very powerful work. So that sounds fantastic. And also thank you for sharing that. Yeah, it's always all very, very interesting to hear. I think about definitely like the differences between the different medical schools, but I feel like in general universities and the different approaches. And there's so many factors that I think people often don't consider when they're thinking about, where their education's coming from and who's teaching their education and all those things. Which, speaking, I guess, on that note, Nav, I know you kind of mentioned earlier a little bit about how you felt that things are kind of changing in the direction of, like professors really listening to students and students speaking out. But what areas do you see the greatest room for improvement in improving health equity in your medical education experience, aside from kind of, student advocacy, I guess, for these topics?
Oh, there we go. Okay, sorry, I thought I was on mute. I think greatest area for improvement for our school is, like I said, like there is that movement towards the curriculum, but in general, we just need to highlight more minority populations. A lot of the time they're showing us the typical, white Caucasian presentation of certain things, and we need the full spectrum, because we're not just seeing patients that are white Caucasian. So we need to understand better what certain, and barriers to healthcare as well. So like there's certain minority populations, if we're talking about the homeless population, and, just taking into account like the barriers that they have to even have access to healthcare, such as transportation, things like that. So just having, I think, overall more diverse presentations and talking about different populations other than just the white Caucasian historical ones that they choose to talk about. But in general, like I said, the profs with the feedback, they are being really great, but it would be great if we didn't always have to interrupt the lectures and ask for resources and it be provided to us later. It'd be great if it was in class, in the lecture, we can have these pictures on hand to study and symptoms and everything to go over like that. So I think in general, the profs just taking maybe that extra time, or the curriculum, to go over and think about how they could be more inclusive towards other populations, because we're not just seeing one population when you're out in the community.
No, for sure. I totally understand where you're coming from. It sounds like a very important thing to consider. And actually, on that note, I was a bit curious. Sorry, I love a side question, I guess. But you're kind of talking a lot about, showing specific images or talking about specific topics during class. Do you feel like that's also reflective in like your textbooks, that almost always these topics are very much covering only like one group of people and focusing kind of on, again, that like, I guess like often the white male story, I guess, of medicine. Yeah.
Yeah, absolutely. So I'm just recalling, we just had a lecture on how to conduct a breast exam, and we had a really great point brought up of, okay, well, they were talking about redness and how you could see it. But again, it was just the white Caucasian. And we had a classmate say, well, would we be able to see, how would this appear on someone who's Black? And is the resources afterwards. And our whole class had to go search online and go digging for quite some time to find an adequate resource that was up to date with current medical information, showing these different populations and races and what to look for. So there are resources out there that are newer, because there is that push to be more inclusive, but it shouldn't be on the students to have to spend time to go digging and find appropriate, informative, and accurate medical information on these topics. The university should very much be offering these resources to us to save us that time. So older textbooks, very much so, it's only the white Caucasian, but there are resources out there, like I said, with the push, but you really have to go looking for them, unfortunately.
No, for sure. Thank you so much for sharing. I guess over to Sabina, do you feel like you kind of resonate with that experience of kind of talking about a lot, with the idea of like representation, but also in the sense of like other areas of improvement that you feel like can be, I know you kind of touched a little bit about that when you're talking in your previous answer, but anything else that you kind of feel like you can really see you'd want to have improved, I guess, within the next couple of years that can really benefit you and also the patient experience?
Yeah, for sure. I mean, my whole thing that I've been really passionate about since even before medical school is LGBTQ medical education. So that is like, anytime anybody ever asks me that, that's always my answer. Obviously, there are many different areas that need great improvement, but for me personally, like the hill that I'm dying on is improving medical education in terms of LGBTQ health, to not only increase the knowledge that our students receive and our trainees receive, but then also with that comes increased representation, hopefully, if it's being done right, which will help advance the experience for queer med students, and then also help advance the experiences and care that queer patients receive anyway. So it's all sort of like a trickle down or trickle up, depending on how you look at it, system. And we have a lot of data to support that right now. There's just a huge lack in terms of how much time is being spent in medical schools teaching students about LGBTQ health, and then what they're being taught is very either outdated or just very basic level, like nothing in depth. And so the onus has always traditionally been on the folks like myself who identify within the LGBTQ umbrella to help push that needle and help advance the curriculums at their school. And this is the case for that you see across the board with all minorities. So, you know, like the onus to improving the education around racism in medicine also fell on me as somebody who's Black, and like the other Black students at my school. And this happens within each of these different affinity groups at the schools. A lot of times the curriculum improvement efforts fall on uncompensated student time, which is the term minority tax comes to mind, which is, as a minority, you're often expected to do more work and to put in more energy and effort to improve the things that need to be improved for the folks who look like you and who identify like you. And so that is a huge area for improvement. Aside just from improving the curriculum, we need to improve how we're going about improving the curriculum, because as it is now, it's taking huge advantage of students' time, energy, and you know, we should be compensated. We should be, first of all, we shouldn't be the ones expected to do the work. The people on the medical school staffs who are paid to, you know, develop curriculum and who are paid to implement it should be the ones who are really putting in the time and energy. But unfortunately, that's not how it works at a lot of institutions. So I think a huge cultural shift just needs to happen overall so that we're not feeling so taxed as minority students to help advance these very necessary changes in curriculum.
No, for sure. It sounds very, very interesting. And also I feel like something that you brought up that's really important is like this idea of like almost like segmenting, where they'll focus on one topic and they're like, okay, when this is good enough, then we'll focus on, you know, increasing like awareness about this topic. So actually a quick, I guess, follow-up question is, do you feel like because like that it's kind of a really big shift of focus on, for example, right now, like gender health inequity, for example, versus that other areas are kind of not being really listened to? Or how do you feel like that's all happening right now? Do you feel like it's like a good mixture of those topics being brought up in medical school?
Yeah, I mean, I think the word silo is actually a really accurate description for it. And it's actually pretty harmful because they're like intersectionality is very real and impacts students, it impacts patients, and it also impacts our ability to make progress whenever it comes to anything related to like social equity, especially in medicine. And so I think by approaching everything as siloed as it has traditionally been approached, you're actually slowing down the potential progress rather than looking at everything as like a systemic issue and saying, okay, where in terms of social medicine can we improve? And then within the social medicine umbrella, what areas are we really needing to focus on? And I think with that regard, obviously, like queer health in medical education has a little bit more that needs attention than some other areas. But that being said, there's no, in my opinion anyway, you know, you're able to work on multiple things at once, but that's where time, money, and resources come into place at institutions, and you need to make sure that they have like the staff and folks on board to be able to do that. But I definitely agree that I think there could be more progress made in terms of how we're approaching intersectionality in curriculum, and also just like in student representation and patient representation and all of that, and how we approach how we're teaching folks to interact with one another.
No, thank you so much for sharing. Yeah, that's very, very powerful. I feel like that's a really important topic, and a lot of people don't. I feel like in a lot of different spaces, not just in necessarily medical school, but that's a topic that a lot of people don't focus on or don't consider to be important enough to focus on, which is extremely unfortunate. Okay, now over to Rainey. I guess a similar thing. I know you talked a little bit previously about kind of your experience specifically with improving, you know, going to like a Jesuit school and things like that. But anything else you'd like to add about how you feel like the curriculum or just in general medical school can improve, like improving health equity?
Absolutely. Yeah, I think that it's been, you know, we're kind of reinforcing this idea of highlighting minority populations. And for me, that really has come to including, you know, queer identities and how they experience the world, especially through things like sex, which is a part of so many people's lives. It's the reason that literally all of us in this Zoom call exist today. is because someone had sex. But despite that, it's completely neglected in medical school. And so this just really blew my mind. And to this day, I still struggle with how little sexual function is prioritized in medical education. And recently conducted a survey, and we found that of these urology residents that I surveyed, 61.5% said that they received 0 to 3 hours of sex ed during medical school. And then even less than that, like 46% said that they received any formal sex education in urology residency. So it goes beyond just medical school. Even the people who are supposed to be the masters of these anatomic regions are really not trained in the ways that they should be to be serving the populations that really deserve it. And I'm really excited to see so many gender affirming surgery programs popping up, and especially at fortunately a lot of the programs that I applied to, I'm really hoping that I end up somewhere where that's something that I'll be able to learn skills for. But I think we really have a problem in our society with addressing shame around anatomy that we've had for thousands of years, and that we really have to have been reinforcing these conversations. And you know, they haven't been talking about sex in a clinical environment, has not been a part of typical paternalistic Western medicine. And taking a sexual history has usually really just revolved around STIs, and really kind of eliminated any conversation of sexual pleasure or dysfunction or quality of life issues that are really important to so many patients. And I think that for at least what I have found is that when speaking to patients, all you have to do is ask. And if students were trained in ways that they felt confident to utilize the language to ask, I think that would change a lot of the ways that they would leave medical school to practice in whatever specialty they go into. And maybe that involves, having medical schools do some sort of role play type situation where they practice saying things like, has sex been a positive experience for you? Do you experience pain? How do your partners identify? Where do you store your sex tools? Do they have a flared base? How many emergency medicine doctors are not asking that question to patients who are getting sent to the emergency room? I think that there's just so much that we could be teaching medical students, and we're really missing the boat on that one. But hopefully, I think I've been seeing so much growth in the area of other advocates, especially on Instagram and TikTok, talking about these things. And I think it is causing a pressure on medical schools to have these conversations and open at least their students up to have interest groups where they can talk about these things openly.
No, thank you so much for sharing. I feel like this is definitely something that has been a recurring topic, especially at Medical Herstory. We talk a lot about these things, and a lot about, just even being able, again, to say the word vagina and things like that, which is weirdly stigmatized still to this day in media and I mean, all around the world. So yeah, thank you so much for sharing. And actually, if I could bring it back to you to kind of start us off for the next question. In your experience, have you seen any, or have you been almost surprised, I guess, by any biases from, students who've entered medical school with you, or who are, I guess, recently exiting medical school, like certain biases or ideas that you're surprised or you've seen consistently that you didn't expect to see kind of entering medical school or even leaving medical school?
100%. So I grew up in Missouri. It's not like I was foreign to the idea of the Midwest or the South and ideologies that come with those areas. But I was in a small group my first year of medical school, and we were essentially doing one of those simulations where you get a case and you have to talk through it, and it's like a case-based learning type situation. And the case was someone who had third-degree burns all over their body, and was essentially wanting to have it was a death with dignity, I think was the type of topic. But of course, a Jesuit institution that is framed very, very differently. And one of the students in my class, who I didn't really know very well, said, well, I don't think that this patient would have decision-making capacity because of the emotional turmoil that they are enduring, much like a woman when experiencing an unwanted pregnancy. And I was just like, what? Where did we pull that from? I just did not expect that. And this person grew up in a very similar area to me, or at least, part of the country. And there were certainly people who, checked them on that. They weren't just like allowed to say that, but that was the first time that I realized like, oh, these people are going to also go on to be doctors, and they also have the power to talk to patients and influence patients. And it's intimidating, and it creates an urgency, at least in me, in the medical education realm, to really like get people excited to not have things like that happen and prevent interactions like that.
No, for sure. Yeah. Thank you for sharing. That is definitely, I feel like, I mean, I'm not a medical student myself, but I can imagine I've had, some discussions in other classes, and I just to hear that happens in medical spaces where it's really about prioritizing the patient and trying to help people is really interesting to hear. And also, I feel like it gives us something to reflect on and think about as well. And I guess passing it back to Sabina, do you feel like in your experience, you've seen any biases in the field of sexual and reproductive health from those who enter the field, or just kind of broad perceptions?
Yeah, definitely. Especially in the field of OB/GYN, I have done a decent amount of research related to how folks approach the topic of sexual and repro health with like LGBTQ patients. And there is so much bias in a field that is historically pretty traditional and very binary when it comes to the gender spectrum, as well as when it comes to like heterosexual versus anyone who's queer. And it's been really interesting and at times quite frustrating to work with and try and push that needle and get folks to really understand that not everybody who comes through our labor and delivery floor is going to be identifying as a cis woman. Not everybody who comes in to have a pap smear is going to, want you to use terms like vagina or uterus. And so there's a lot of bias that goes into it. And I think, again, this really comes with what we were talking about a lot earlier in terms of the generational shifts and the pressures from society as well as media and students to just do better for our patients. And then we also have a lot of data and evidence supporting the need to have improved healthcare in terms of the experiences that our LGBTQ patients are having in sexual and repro health spaces, but then also in terms of the outcomes that they're having in these spaces. And that all falls back to how they're being treated and received by physicians, which unfortunately has historically been not great in terms of the discrimination that folks are experiencing, and in terms of the standard of care that sometimes it just isn't being offered to people. We know that people who are trans identifying are less likely to get a mammogram or a pap smear, even if they might have the anatomical parts that require such screenings. And that's really because of a lack of education, both at the med school level and residency level, that those providers just never had. And then also just bias and not really understanding how it all works. And so I think open-mindedness can really improve folks as individuals, but also it can really make a huge impact on our patients. So agreed. There's a lot of bias.
No, thank you for sharing. It's always interesting to kind of hear a variety of different perspectives, but also to, see what you've personally like seen in the hospitals happening, and also all of these different facts and research and all of these things that you've done. Everyone on this panel, it just sounds very, very fascinating and also really, really important. And I'm really glad that we get to have the space for you to share it with all of us, people who are also not in medical school, who are just like myself, who are just very fascinated by this and want to see a lot of these things improved. And I guess, again, last but definitely not least, again, now, do you feel like you've also seen certain biases from people who've like entered medical school, or maybe also from, specifically your professors or other doctors that you've kind of interacted with?
Oh yeah, I feel like I'm just mirroring everything that's been said already. There's definitely biases still. And I mean, it's because everyone's grown up in this historically the society that it's just ingrained that there's these biases. It's, heterosexual sex and this common cis woman for going in for pap smears and all of this. So it really a train of thought needs to be shifted. And I'm just thinking, I used to work at a family doctor's office for 2 years. And I remember we had a transgender patient and we needed to refer them out to a specialist. And I remember trying to fill out this referral form, and the spot for gender was only male or female. And I had to stop, and I was like, had to go talk to the physician, and we had to figure out how we were going to relay this information that this is a transgender patient. And that's a key piece of information that the specialist needs in order to adequately provide healthcare to this patient. And it's something as simple as just having a checkbox, right? Like, we can't just have black or white, male, female. There's such a spectrum now, and we need to be inclusive of everybody because it affects their health and how they're going to be cared for. So there's definitely implicit biases that need to be addressed. And like I said, the shift is happening slowly, but again, something as simple as just having these forums be more inclusive so that everybody can adequately get the care that they need. So it's slow, but yeah, things need to be addressed for sure.
No, thank you for sharing. This is all so fascinating. I feel like I'm almost like in awe whenever it's my turn to speak at this panel, just because it's so interesting to hear a lot of these things and to also hear about your amazing stories and your personal experiences within this field. And so now we're going to kind of shift. It's basically our last question of the structured panel. So for our participants, please feel free to take this time to also write out a question, maybe in the chat, or also we'll have a space to, if you'd like to raise your hand and ask a question, please do feel free to do that, because this question's a little bit kind of tying in everything back together. And also, I hope it's okay. I'm going to add in a little bit of an extra part to this question for the panelists. So kind of the main question is, why do you believe gender health equity, particularly in regards to sexual reproductive health, is important? But I'm kind of interested if, within that sense is also why do you feel like it's important, or how do you feel like you can better utilize, or how you can utilize your social media? Because I know that the three of you all have really fantastic social media accounts, which everyone should check out, by the way. We did link them in the chat, but definitely check out all these three amazing speakers on their social medias. But why do you feel like this topic is particularly important to discuss, and specifically to sexual and reproductive health on social media as well? Sorry, I didn't pass it off to anyone. And now would you like to go first?
Sure. So I feel like patients need to feel comfortable approaching their healthcare providers about sensitive topics. That comes along with sexual and reproductive health. So many things that is like the basis of issues. And a lot of time patients don't feel comfortable bringing up these things. So then their issue may be stemming from something as simple as they're having pain during sex, or they're having, I don't know, unusual discharge, but they're not comfortable bringing that up to their physician. And so then the issue gets prolonged, it becomes more complicated, and they'll never feel safe to do so if you're not immersed in an equitable and diverse environment where the physician makes it a safe space to speak to them about these things. So I definitely think sharing experiences and interactions with the healthcare system is really paramount to providing good overall care for your patients, and especially on social media, like I said, where you can reach such a larger audience. Having open and honest conversations, helping to decrease the stigmatization around these things, just even by saying the word vagina, vulva, sexual health, it makes people more comfortable in realizing that there is nothing wrong with saying these things. This is your anatomy. It's just like saying your arm, your leg. There's something in my eye, to go on to say, I'm having issues, genital issues, or whatever it may be, sexual health, and it's just another part of the body. And that's what we're here to do as providers, is to address those concerns. So absolutely opening up the conversation and making people realize that there's nothing to be ashamed about, and they really should feel comfortable addressing their providers with these issues so that they can receive proper care.
Thank you so much for sharing. And I guess to transition to Sabina, would you like to add on anything to what Nava was saying?
Yeah, I agree completely. I also think that, there's so much of our research and so much of our training that we base education currently in medical schools on, historically has been based off of studies and what we knew only about cis men. And obviously 50% of the population are anatomically born female, but then even beyond that, there's like the gender spectrum and people who are non-binary and trans, and that population is increasingly growing. And so as our world becomes more diverse, it is really important that we're ensuring that our care is being upkept, and the education that we're receiving is being updated to ensure that our providers know how to, care for the patients that we're inevitably going to see. And if we're not trained and comfortable caring for patients in sexual and repro health spaces, then that really isolates a huge section of the population, and it can lead to some dangerous outcomes, like Nava was saying, for sure. And social media plays such a huge role, not only in education, but also in community and networking, like I was mentioning earlier. For example, I run Medical Student Pride Alliance, which is a national nonprofit that's entirely virtual and entirely social media based. And we, through that network, we've been able to communicate with providers and leaders in the field of LGBTQ health and leaders in the field of medical education. And we've been able to work with our chapters and members across the country to push the agenda and to really make really decent strides in terms of improving access to medical school for queer pre-meds, but then also improving the education that students are receiving across the country at their own med schools about LGBTQ health. And that has all been through the efforts of social media. And so I think it gets a lot of hate, but I think social media is a really beautiful place if it's used in a nice way. And I've been really fortunate to experience the good sides of it.
No, that sounds like some really incredible work. Yeah, no, that sounds really, really fantastic. So thank you so much for sharing, and also for, well, to all three of you for sharing so much about your lives very openly on social media. I mean, kind of going back to this, I know again that I'm not a medical student, but I think it's so important that your social media reaches not just people who are medical students, but it's like educating patients about these things about medical school, which is so fascinating and so important. And then it helps patients also understand things like, what can I ask? What can I do differently when I'm approaching my doctor? Which is something that, I think I've never really considered as much when you're thinking about just kind of, I need to go to the doctor. So thank you so much for sharing these experiences on social media. I mean, I think it's helping not just fellow doctors and medical students, but definitely your patients as well. And I guess last but not least, Rainey, would you like to add on about kind of how you're using social media and the kind of why you think that this is really, really important? And then after that, we'll have our Q&A session. So again, reminder, send in those questions.
Yes. Yeah, I am totally going to echo. Am I unmuted? People can hear me, right? Okay, good.
You're all good.
Sorry, it's giving me a pop-up saying it was unmuted. Totally echoing everything about how important it is to prioritize patient autonomy and like giving patients permission to be empowered and to take agency in their healthcare and not just kind of let healthcare, take over them. And I mean, I think a huge answering the question, like, why do you feel like gender health equity is important? I feel like just discussing my background with researching the word vagina just kind of like helps convey how I feel about that. So I recently did this study where we looked at all of these examples of where the word vagina was censored in popular culture, in education, in media, in politics. Like, I think the craziest one is in Grey's Anatomy. They literally created the word vajayjay because Shonda Rhimes was told by ABC network broadcast officials that she could not use that word because it was too profane. And this was after in a previous episode in the first season, they said penis like 17 times in that episode where she like carried it around in a box of ice. So there was that example. On MTV, they used to censor Mean Girls, and they would censor the words lesbian and vagina, but not censor the word slut and whore. So that just sends a whole great load of implications to viewers that no one would ever want. And it has dangerous outcomes. These censoring, I mean, even speakers on the floor of the House in the state of Michigan being barred from speaking for using the word vagina in a speech about reproductive rights, art teachers getting dismissed for talking about Georgia O'Keeffe and using the word vagina. It runs very, very deep, and that trickles into our medical education. And I didn't realize, how dangerous those outcomes could be until really working in urology and OB-GYN and seeing what happens when people, because of the discomfort and shame that our society has created around our anatomy, what happens when they delay care and they delay a physical exam, and you come to the ER and end up with a long hospital stay, many surgeries, and potentially fatal diagnosis. It's really, really tragic, and people don't realize, especially, patients who have comorbidities like diabetes. It's very, very difficult to convey to people how important it is to pay attention to your genitals. And so I'm hopeful that by taking away some of that stigma and making it just as easy as talking to a friend and a casual conversation and a word, just like all of the other words that we use, and how sex tools are just like all the other tools we use to make our lives easier. I'm definitely excited in the world of pediatric urology for the conversations that are happening about consent, and there's a different terminology now, but it used to be disorders of sexual differentiation. I think it's differences of sexual differentiation now, because that's essentially an intersex anatomy and how the urologic world is going to be handling that. I'm, as a bioethics nerd, incredibly interested on how we're going to figure that out. And I think it's really, really important that it's all coming to the surface now.
No, thank you so much for sharing. That sounds very interesting, but also a lot of these things that you don't think about in like pop culture. Like, for example, I've definitely watched Grey's Anatomy, and it's something that you almost don't, it like just totally flies by you because it's something that has become so normalized to censor censor words like vagina, but also censor some of these topics that are very, very important to gender health equity. So yeah, thank you so much for sharing. So that kind of concludes the, I guess, formal part of our panel, but that does not conclude the fact that our lovely participants can ask some amazing questions to our panelists. So one of the questions that's asked kind of actually almost at the very start of the panel, but I thought was really, really interesting and a great way to start off our Q&A is, do you have any advice for speaking to your university about changes or additions to your curriculum? And I'll kind of leave the floor open for this. If there's anyone, I won't necessarily pinpoint you, but if anyone wants to start off that conversation or add anything on, please do feel free to do that. But yeah, any changes, any ways that you can kind of, any advice you have for speaking to your university? And I know a lot of you talked about some amazing changes you've already done, so yeah.
I'm happy to start this one off just because this is an incident I ran into yesterday, actually. So on a slightly different topic, but I was dealing with, it's called like our learner wellness, and their whole thing is they're here for us and our mental well-being. And it's a very great addition that they've made to the school curriculum. If you ever need help, you're feeling distressed, you can reach out to them. And anyways, I had reached out maybe let's just say like I reached out on Monday and I didn't hear back until Friday, which I was quite disappointed with. For myself, I had let them know that it's not urgent. I would just like to have an appointment. But I said, and I sent them a nice email, but so this is going into how you can communicate with your university. As long as you're doing so in a professional and respectful way, you can always get your point across. And so I let them know, I said, I'm a little bit disappointed in the time that it took to hear back about this. I said, especially when some students may be reaching out with urgent mental health concerns. I said, I'm saying this so that hopefully we can learn from the situation and ameliorate it for the future so that students that do feel like they need to reach out, they are addressed more promptly and more in a timely manner, because sometimes it can be deterring to students when it takes a lot of courage to reach out and ask for help when they're not addressed immediately back. And I just said it like that. And it's very okay to say things like that, as long as you're phrasing it in a way that's professional and respectful, like I said. So that in term to going into sexual reproductive health, absolutely you can do it in the exact same way. If you're not happy with something that's being taught or the information that's being given, course feedback. I know a lot of students hate filling out course feedback at the end of semesters, but really that's where the change can be made. And you can exactly phrase it like, I felt that this topic was lacking and I was a little bit disappointed in how this was touched upon. And I feel like there should be more information surrounding X, Y, Z. And so again, as long as you phrase it in a respectful way, absolutely people are going to be more receptive to that. So never feel afraid to voice your concerns. Like we said, it's the students now that are shaping the changes that are being made. So make your voices heard. Absolutely. If you're seeing something that's wrong and you don't agree with, absolutely stand up for it. And there's a proper way to do it. You can't just, rant and go off on them. But if you shape it and phrase it in a nice, polite way, then people are going to be receptive to that.
No, thank you for sharing a personal experience. That sounds like I definitely resonate as someone who I recently graduated university, and I definitely feel like a lot of these things are common topics that unfortunately, students talk about, but then aren't necessarily always talked about with like administration, things like that. Would anyone else like to kind of add on to this topic before we move on to our next question?
Yeah, I agree with what Nava said. And also there is a lot of power in numbers when it comes to advocating at your school. So, sometimes if it's something small, I'll feel comfortable just emailing the course director or whoever it is. But oftentimes if it's a larger, bigger undertaking for curriculum restructuring, then that'll involve making sure that I have a decent number of people on board with me. And so I have reached out through different organizations or clubs that I'm a part of at med school. Sometimes we'll create a survey and get other med students in my class on board, or to share their experiences and why they think this is something that we need to change. And then I also think most importantly, when it does come to these larger shifts that might be more than just an update on a website, but rather an actual structural change, getting faculty champions on board is really key, because they're the ones who are behind the doors, who can really speak for you and for your efforts and what you're advocating for when you're not able to be present. And they have a little bit more buy-in than you might as a student voice. Your voice is really important, but just strategically when it comes to advocacy, having somebody who has a little bit more quote unquote power, like a faculty person who can go head to toe with or head to head with a dean, can be really useful. And then thirdly, pulling in examples from peer schools at similar levels or ranks, or however you want to view it, that has been really helpful for me too, especially at an institution that is constantly competing and comparing itself to other med schools. If you can be like, hey, look over here, Harvard is doing XYZ, or whatever school is doing XYZ, we're really behind the times based on this evidence and data, then they can't really argue with that, because they are. And so then it just comes down to advocating for why this needs to happen at our institution and how it can happen.
Yeah, for sure. Thank you for sharing. I feel like some very fantastic advice, especially I feel like not just only for medical school, but also just if you're in a program that also focuses on a lot of these different topics that, maybe not directly relating to medicine, but ways that you could change that program as well. So thank you so much for sharing. Rainey, would you like to add anything before we move on to the next question? Or I can also, actually, I think the next question, I kind of, it's a link to this. And I feel like you might be a great person to start it off if you're okay with me just skipping on to that.
Yeah, I think I was accidentally answering that one anyway. So that's totally cool.
Good. Well, that's why I actually wanted to kind of bring it around to you, because the next question, I'm going to skip ahead a little bit in the question queue because I think it links really well. But did you worry about speaking out online or to your school about issues of sexism, shame, and stigma, knowing about potential pushbacks from your school or from your online audience? And how did you deal with this?
Absolutely. When I first created my page, I was terrified. It was private. And I was like, it's pretty hard to grow when it's private. And then I kept it a secret for a very long time and I would see people from my class finding out about it and following it. And I would be like, okay, whatever, I'm not going to worry about it. But it did make me really nervous, especially in the context of the education I was receiving. And there were certainly members of my class who probably have their own unique opinions about the work that I'm trying to do that I've gotten word of. But essentially, after the first year, I kind of confessed this fear to a dean. And this was a dean who was notoriously more progressive. And I showed him my page, and he was like, I think this is incredible. And I looked on his wall, and all of his research that he had done kind of in a past life before medical school was very much in line with kind of some of the gender type research I had done. And so he basically said, if anyone gives you trouble, I will help. And I, was like, well, that might not be enough. And so I continued to, as I went through my clinical rotations and met other educators and physicians, and worked with other people in my field of interest, when I found it appropriate, in the work setting, and knew their interests were aligned with mine, I would kind of tell them about it or test the waters. And whenever I got a good reaction, it was incredibly validating. And then eventually I got enough good reactions that I kind of stopped worrying about my school. And I think one of the other things that helped a lot was that I knew that at the moment I wasn't going to have anyone at my school who was going to want to like do the research that I had wanted to do, especially because our OB-GYN department is just very, very different than like the kind of programs I had worked at in the past. And so I sought out mentorship at other institutions, and especially institutions that carried some like large weight. And I think that when my school saw my collaborations with other institutions in this space of sexual medicine, they began to take that a lot more seriously, and actually inviting me to talk to the underclassmen about a sex ed 2.0 that we should have gotten before medical school, or just having opportunities to talk to the internal medicine residents about what they might be missing when they're doing their general history and how they could do a better sexual history. I think mentorship is incredibly important, and having people to back you and that will have your back if anyone comes to critique you and say that what you're doing, try to invalidate you. Having those people has certainly felt like a safety net. Unfortunately, I haven't had really too many occasions where I've had to lean on that safety net because of I think when you use evidence-based medicine to make a point, people can start to listen.
No, for sure. Thank you for sharing. And also really interesting to hear kind of about your own personal experiences. And to some extent, nice to hear that, you haven't had maybe as much pushback in the sense of that, people are really listening and willing to incorporate a lot of these ideas and change into their life. So yeah, for sure. Sabina or Nav, would either of you like to add kind of if you had any fears about speaking out about a lot of these issues, and also if you were worried about some pushback from medical school or from your fellow students?
I know when I first, started posting my videos of my experience, I was definitely nervous just in general about people judging because social media is a judgy place. And it's like, I'm not trying to be anyone. I'm not trying to be an influencer. My whole goal was just to try and share my experience so other people didn't feel alone. And, at first it was hard. Like I didn't get any bad negative comments, but always in the back of my head, I'm like, oh, this person probably saw my page. They're probably making fun of it or whatever. But, the more I kept sharing, I would get emails from pre-med students that would say like, I've loved following your journey. You're really inspiring me and it's helping me. And then they would start asking me questions. And honestly, getting an email like that makes all the other fears go away, because it's like, okay, this is exactly why I started this. And clearly it's striking a chord with other people and they're saying it's helpful. So why would I stop doing that out of fear of judgment of others? Because there's absolutely nothing to judge. If you're just sharing your experience and you're trying to make a genuine positive impact on other people's experience and help them, then there's nothing to be shameful about. So absolutely, at first it's a scary place. Like you said, social media, there can be backlash about anything, especially with this whole cancel culture. And, we get a lot of lectures at the beginning of school about professionalism and, what you can and can't say and share online. And I have found that a little stressful to try and, share my experience with still staying in line with those. But honestly, like I said, as long as I'm just talking about my own personal experience, then I don't really have much to be scared about, because it's just my personal experience and I'm not, giving away any patient confidentiality or anything like that. Like, it's just genuinely giving them the run of what's going on in my life and what I'm liking, what I'm not. So overall, I've gotten a lot of positive comments from people that have said it's helpful to them. So I think that's what keeps me going. And I'm sure a lot of the other panel speakers as well have received similar feedback. It's nice to see that you are helping others.
No, for sure. Thank you. And I feel like, if it says anything, I feel like you're helping everyone in this Zoom chat or group today. All three of you have just really blown my mind in many ways about all of these things that I think I haven't never even considered about. And I consider myself to be someone who really dedicates a lot of time to these topics. So thank you so much for sharing and for really educating us as well. And Sabina, would you like to add anything before we move on to the next question?
Yeah, I mean, I echo everything that folks have already said, and I agree. Like the positive messages and the positive feedback that I receive really keep me going, knowing that like my presence is making an impact and really helping folks. I am when I stepped into the clinical rotation side of med school, I was nervous because you know I on my social media page I'm completely transparent about my undergrad GPA and my struggles with step 1 and step 2 and all of that, and so I was worried that folks might view my page and think that like, oh, this med student isn't smart enough to be here or whatever. That never was the case, or if it was, nobody ever said that to my face. But rather I had folks in the hallway like be like, oh, you're the curly med, like I follow you, I love your stuff. And I would just be like really awkward about it and be like, oh, like thanks. But and then on social media, of course, there's the dark side. And so every now and then I'll get an unfortunate like racist comment here and there, or something about like not wanting a doctor who didn't do well in undergrad and things like that. But I either have followers who go to bat for me, or I just block that person and report them and kind of move on with my life, because I don't really entertain haters. But I've on the flip side, the other side of the question was pushback when it comes to advocacy and things like that. So I have LGBTQ health, and so on social media spaces I get a lot of pushback that comes through either hateful comments or messages, or just like a lot of times like if I'll post a video of my fiance and I out, or like I think I posted a picture of us like kissing a few weeks ago and I just lost like so many followers. And so that's the form of pushback that I've gotten so far, which is really interesting to me because I don't hide the fact that I'm gay at all online. And so it's like if you followed me from the beginning, then you should know that I'm gay. And so like I don't know if you just like don't like the image of me like kissing my fiance like really offended you, like I don't want you to follow me anyway. But in fact I haven't received any, and I actually have been partnering with the school to write a social media policy that actually encourages folks to use social media as a tool rather than discouraging people to use it because of antiquated viewpoints about social media being bad.
That sounds like very powerful work. And thank you for sharing. And also thank you to all our speakers for your vulnerability throughout this entire process. Like I know a lot of these questions are also about, your personal lives and about your social media, and kind of part of this is like your quote unquote job to some extent, right? As well, aside from, being like a full-time medical student, which is just baffling to me that you're able to balance so much in life, and very impressive. But yeah, thank you so much for all that vulnerability, and also just for sharing all these experiences and amazing work that I think can inspire many people, but also kind of show people what really exists out there. Okay, kind of switching gears a little bit. Something that we touched upon previously in the panel was intersex patients. So someone asked, is there currently any space in the curriculum that touches upon intersex patients? And have you seen that, or what kind of like, where do you feel like maybe there needs to be room for improvement in those things? Again, floor open to anyone. Is there anyone who'd like to, who has experienced this or like to start speaking?
Yeah, I can talk about this. I recently did an away rotation at a hospital and was pleasantly surprised when it was peds, and the attending was a older gentleman, and he gave us a talk about DSDs, which is essentially a talk about intersex embryology and how everything forms. And at the end, when you get to the like assessment and plan, like the treatment kind of portion, there's like all of these big questions now, because there's a lot of changing ideology around intervention, especially from a urological standpoint, of genital tissue, of doing gender affirming surgeries to essentially people who cannot consent to them, who are too young. And so I was really pleasantly surprised that this program was teaching their residents about that. Now, in terms of my medical school experience, I would say that it was very, very minimal. And if anything, I think that I would have brought that kind of energy to the rotations, but there really isn't a place where that fits into the curriculum, at least at my school. I'm really curious to hear what the other panelists have had to say.
Yeah, at my school, we got a lecture on it during first year in genetics, but it was and by lecture, I mean, it was couched into the lecture on chromosomes or whatever, and it was not great. So myself and my peers within the PIT MSPA, the LGBTQ health or LGBTQ group, reached out to the course director and also the dean of education about how we can improve intersex education as a whole for the preclinical students, and we were able to improve that lecture, meaning reworking because the language around it was super stigmatizing and not really up to date at all, and the things that they were teaching were not helpful for patients, and so we helped restructure that, and then also advocated for just more patient experience. And so my school does patient panels every now and then, and we asked them to look into setting up a patient panel focusing on intersex individuals who would be willing to share their experiences with healthcare and kind of what they wish their healthcare providers did better, and things that they have liked about their experiences thus far and things like that. So now that you bring it up, I'm actually not sure where that ended. I don't know if that happened because of COVID. It kind of interrupted things, but I'm going to circle back to that now with my school and see if they're doing that. But we've definitely improved the lectures. So I think now they maybe get one actual real lecture on it during preclinical years, and then clinical years it's hit or miss with kind of what you get on rotations, unfortunately.
Thank you so much for sharing. Now, would you like to add on, or do you want to move on to the next question?
I was just going to say, I'm so early on in my medical school. I'm really only starting my second semester in med school now. So I haven't seen anything with regard to intersex curriculum yet, but that's not to say that it won't happen. But like I said, I've only really had a semester and a bit worth of classes. So hopefully it's coming. And if not, like I said, students will be pushing for that anyways. So.
No, for sure. And also thank you. I love the fact that, you're just starting out medical school versus Sabina and Raina kind of towards the end of their careers, but it's really interesting to hear how you're really echoing a lot of the same ideas early on and later on. So it's great to have so many different perspectives. And also thank you for sharing all these things. I feel like I know, I don't know, just very, very inspirational and a lot of really, really great things to reflect on once we also all leave this Zoom call. But okay, so to kind of thank you everyone for all of your questions. I think we're going to wrap up with one last question before we kind of, I guess, say our thank yous and goodbyes. And really, again, I'm going to keep praising our speakers just because they're so fantastic. But last question for the Q&A is, are there resources for current practitioners who may or may not have run their practice in an inclusive way in the past to learn and reconstruct their practices to become more diverse and open for their patients? So really, do you feel like there is those kinds of resources available, or do you feel like that's something that really needs to be improved as well? Again, leaving the floor open, whoever would like to start, feel free to start.
Yeah, from the perspective of sexual sex ed in medical school and things that providers should be learning about, I think two really good resources for people who are interested in going into fields of any sort of pelvic health are ISWISH, which is the International Society for the Study of Women's Sexual Health, and SMSNA, which is the Sexual Medicine Society of North America. And they are closely aligned with ISSM, which is the International Society for the Study of Sexual Medicine. And all of these programs have really good, email, educational email, or I just got one that is going to inspire content that I'm going to make about what is, what was I going to do? This is good. What is high risk sexual behavior? I was like, oh, awesome. And I can cite it. And there's a study on everything attached to it. So there's really good resources there. And in terms of resources for queer people, and especially in the world of sexual health, I found that the book Bang by Vic Liu is a really great resource. And it is essentially a guide to masturbation for all genders, and a really great way to smash shame quite directly, and also kind of figure out lighthearted ways to communicate with your patients about how they could better influence their own, private sexual habits and what is a healthy sexual habit and stuff like that.
Yeah, thank you for sharing. Sabina, now, do you have anything else to add on?
Yeah, specifically for ways as a practitioner to make your practice more inclusive for queer patients, there are a handful of online resources that have been created because they recognize that that's not something that you might receive from your institution or from your medical education prior to having your own practice. And so I'll send links in the chat for you to read on your own time. But there's a really great organization called Out Health, and they do a lot of webinars, which are like this, and they're free to the public, educating on various topics. And then also they have like a training program, and they also have a directory on their website of gender affirming providers across the country. There's also the Safe Zone project, which is not health specific, but rather just a online resource that you can use to become better educated about how to be more inclusive in terms of like language and actions for queer people as a whole, which easily apply to the healthcare field. And then if you're an educator and you want to learn more about how to teach better when it comes to LGBTQ health, not necessarily like topics within LGBTQ health, but like if you're presented with a small group case that is LGBTQ health and you're not really familiar on the language and such, there is a really great course that MSPA, my organization, partnered with Stanford to create and offer for free called Teaching to Teach. And it's a free online course that walks you through really from start to finish how to become a more inclusive educator. So I'll send those links below. And then if you're a student, there's always Medical Student Pride Alliance, MSPA, and I'll also send our website there too.
Amazing. Thank you so much. And now, do you have anything to add before we kind of wrap up the panel?
I was just gonna say, these all sound like really great resources. I've never heard of them personally, so I'm excited about that. I was just gonna add, as everyone says, medicine is a lifelong learning experience. And even just working with the family doctors that I was, they're constantly online looking at new resources just to reference and see like new guidelines. So it is great that there are these online resources, because I can 100% see practitioners easily integrating these into their practices. Because like I said, they're constantly online doing critical appraisal of different research articles and medication and lines of treatment. So it's a very easy switch to also have these now attached and just reference if you're unfamiliar with how to go about or approach certain subjects or sensitive subjects that shouldn't be sensitive subjects. So it's great that there are these resources.
No, thank you so much. Yeah, I feel like I love that. I like the idea of like medicine being like a lifelong learning experience. I think that's really important. I feel like, anything in life is that way, but I feel like especially with medicine, it's something that's so key to include, just like as we spoke about during this entire panel. Yeah, thank you so much to our amazing speakers for all of your vulnerability, sharing your experiences, all of your amazing thoughts and discussions. It was very lovely to meet everyone, and it was so lovely to work with you. So I just want to say a really, really big thank you. And if everyone can do one of those round of applause emojis, or like the little celebrating emoji in the chat, just to say thank you to our speakers, because they just really, really did a phenomenal job and are gonna, I know, go on to do amazing things. I would be lucky to be any of your patients. So yeah, but before we kind of wrap up, I'm going to actually pass it on to Tori to kind of give our closing remarks.
Yes, well, thank you so much again to our speakers and everybody that came out today to hear about such an important topic. I have such respect for people working within medicine and working every day to break down barriers. As we talked about, there is so much bias left to be undone, so much sexism, shame, and stigma that is really deep rooted in our healthcare system. So anytime we can push for change, we're definitely here to support it. And just to say, Medical Herstory is such a big supporter of people working within the healthcare system, and tell our speakers, really looking forward to collaborate in the future. And for everyone else listening today, we hope that you continue to follow us, support events like this, maybe bring one of our workshops on gender bias in healthcare into your own med school classrooms. And finally, just follow us on social media to stay up to date. We'll be sharing a recording of this event that you can share with your peers, as well as some key takeaways. So stay tuned for that. But to everyone, yes, thank you again for coming out, and we hope you have a great rest of your day.
And so sorry, just before everyone logs off, for our participants, there's a feedback form in the chat. So please do take 60 seconds if you can to fill that out. It'll be really great help for future events, and to kind of learn more about what you want to hear, so we can cater events that fit kind of your interests and needs as well. Thank you again to everyone for coming out, and have a great day.